everyone, good evening. I hope you're all well. My name is Darwin Chimba. I'm a final year medical student from Bivariate University School of Medicine in Zambia, and I'm the president of the Association of East African Neurosurgeons. So today we are going to have a journal club presentation by Dr. Chibwekem. And before we get into the presentation, we're going to have those that have joined us to introduce themselves. So I'll be calling out names so that people can introduce themselves. Dr. Daniel, Dr. Sandy Daniel, you can introduce yourself.
Hello, everyone. I'm Dr. Arsen Daniel Nyalunja from the Democratic Republic of Congo. I'm a medical doctor and I'm the AFAN representative at the G4 Alliance. Happy to be here today.
Thank you so much, Dr. Daniel. Then we have Chibweze.
Good evening, everyone. I'm Chibweze Wama, a 511 medical student from University of Lagos. Yeah, nice to be here. Good evening.
Thank you so much, Chibweze. Thanks. Then we have Claire.
Good evening. I'm Chemtai Claire from Jomo Kenyatta University of Agriculture and Technology, Kenya, a second-year medical student.
Thank you so much for joining us. Then we have Jeremiah Daniel.
Good evening, everyone. I'm Daniel Jeremiah, second-year medical student from Obafemi Awolowo University, Nigeria. I'm glad to be part of this.
Thank you so much, Jeremiah. Then we have Jesutomi Olayemi, sorry.
Oh yes. Hello everybody. My name is Tomi Olayemi. I am a medical doctor. I finished from College of Medicine. Let's say TBK's colleague. Yeah, so it's good to be here. Yeah, bye.
Oh, thank you so much, Dr. Olayemi. We're glad to have you here. Then we have Nyontle.
Good evening, everyone. I am Neontle Sakaiwa. I'm a fourth-year medical student at the University of Botswana. I'm also an AFAN research fellow and country representative for Botswana.
Thank you so much, Nyontle. Then we have Shepard.
Good evening. My name is Shepard Motebe. I'm from Botswana, but medical student in Eden University in Zambia. Thank you.
Thank you, Shepard. Then, last but not the least, we have Waxon.
Good evening, everyone. My name is Waxon Lukere, a third-year medical student at the Bivariate University, Zambia. Thank you.
Thank you so much, Waxon. So at this time, I'm going to hand over to the presenter. Please, you can introduce yourself and begin the presentation. Thank you so much.
Thank you, Darwin. Good evening, everyone. I am Anthony Chibukem Ekwebwing, research fellow, research associate neurosurgery with Cornell Brain and Spine. I'm also a research fellow with AFAN and AFAN's general secretary. So sorry, I would not be able to turn on my video because my webcam is bad at this time. I hope I can still go on with the presentation. Okay. Okay, let me share my screen. Okay, can we all see my screen?
Yes, we can.
Awesome. Okay, so this is a journal club. Okay. So some basic rules about journal club is it is a sort of it's not a lecture, so it's a discussion. So we're going to have like back and forth conversations. So basically, it's like a conversation. For you to get the most out of it, you should have read the paper we're going to be discussing. Yeah, basically. So those are very two important points. Okay. So today we're going to be discussing this paper. Was recently published sometime in March. Paper is titled Case Mix, Management and Mortality of Patients Receiving Emergency Neurosurgery for TBI. It was done by a group of neurosurgeons, neurologists who work on neurotrauma by David Clark and colleagues. And it was done on behalf of the Global Neurotrauma Outcome Study, all right? Okay, so I hope a number of us went through the article. It was a very robust paper that basically characterized what the mortality is, like kind of like giving like a global epidemiology on patients who are managed managed surgically for TBI, all right? So for this presentation, we will be using, so we'll be using this to kind of like talk about different sections. Would go through the abstracts, try to answer these questions. Would also look at the introduction and the background, try to answer those questions as well. Look at the methods, look at the results, the discussion, and then what our overall thoughts was on this subject, on the paper. All right. So, but before we go on, so I like this. So I'm sure we can see this box that says research in context. So some papers, they usually would have either like highlights or something like this, kind of like giving you so it's not an abstract per se, but it's just like a quick overview of everything of what the paper is all about. And then just reading this box and looking at it, kind of like how I put it, so it just quickly summarizes what this project is on. Okay, so before we go on, can anyone just kind of like give me an idea of their general thoughts on the paper? That just kind of like a summary of what the paper was talking about before we move on. Okay, how many of us read the paper?
Yeah, I was able to read it properly. I was able to go through it well.
Okay, so did anyone else look at the paper, read it at all? Okay, so anyways, so as I go on, if you have any questions, please feel free to ask. So the first thing they did was, so they kind of like tried to, before carrying out the study, right, try to figure out, okay, so what has been published on this particular project? And it's very important to do this first section, evidence before this study. Anytime you're trying to answer a new research question, right, anytime you're trying to design a study, it's very important to see what has been out there. So usually some people do like a quick literature review, go to PubMed, AMBase, whatever, use search terms, and then try to see, okay, this question I'm trying to answer, has it been answered in any form before? Which is what they did. And not only did they do a literature review, they did a systematic one. So they did a proper systematic review to see, okay, this question we're trying to answer, has it been answered before? And then basically, no, it hadn't. So that's what this particular section is telling us, right? And they go on, this summary box goes on to tell us, okay, what value is this study adding, right? Basically answering the question which they set out to, the research question which they set out to answer, right? And then they give us the implications of the available evidence, all right? So to the article proper. So the first thing, right, when you're critically appraising any article is to look at the abstract. So our first set of questions would be on abstract, title, and references, right? So did they state clearly the aim, right? What they found, their findings, did they state it clearly? And then did they tell us how they did it? The title, is the title informative? Like looking at the title alone, does it tell you, give you an idea of what the topic is or what the researchers found or were hoping to find? And the references used, were they relevant, recent, and then referenced appropriately? So first things first, when you're looking at an abstract, right? When you're looking at the abstract, so the abstract is the summary the paper, right? So the first question was, is the aim clear, right? What we're aiming to do. Now, when you're looking at an abstract, the background section, right, is usually written as 3 sentences or 2 sentences, right? Two broad concepts are usually put in the background. The first concept is what the gap is, right? What the knowledge gap is. The point of every research is to kind of like fill in a knowledge gap, right? So that's the first aspect. The next aspect is what the aim is, right? And here we can see that their primary goal or their primary aim was to characterize what the differences were in case mix, right? Management, and in the mortality of patients who have TBI when they're managed surgically across different levels of human development, right? So that was their aim, okay? So for our first question, I think, yes, it's clear from looking at the abstract. It's clear what they set out to do, right? Now, remember I said in the background, when you're looking at an abstract, the first section, kind of like the first few sentences tell you what the problem is. And here in the background, they tell us that first thing is they tell us that TBI has a large global burden, right? Next, they tell us that surgery is important for treating patients with TBI. And then the last aspect is they tell us what the actual gap is, that there is little epidemiological data available, right? And then they go on to tell us what the aim of the study is. Now, the next questions for this first section is, so is it clear what they found, right, in the abstract? Okay, so does anybody have any questions on this part now? Okay,
no
so
question.
no question. So the next aspect is looking at, so the next thing was it clear what the study found and how they did it? So basically asking us what in their abstracts, the method section aspect and then the result aspect, is it clear what was done and what the findings were? And yeah, I mean, it's pretty clear. First, they tell us the study design. This is one of the most important things you put in your methods. The study design. They did a prospective observational cohort study, all right? And they also tell us how they selected the various patients and hospitals. And then they tell us the timing, the time period when these hospitals were selected and patients, right? They tell us what their primary outcome is. Usually very important when you're in your methods. And then they also tell us how they went about the analysis, although brief, but they do mention it, right? They mention they use this mixed effect logistic regression, right? So yeah, it's clear how they went about the study, right? So methods is usually one, study design, study population. So those are things you have in your methods, and that's what we can see here, right? And then it's also how data was analyzed. And then they just quickly told us that as well. Next question we're trying to find out is the findings of this study, is it clearly written? Yes, and I think it is. So usually when you're writing the findings section of your abstract, it's usually should start with, usually starts with giving descriptives. So basically univariate your results from your univariate analysis, right? So descriptive statistics, so frequencies, means, and all those things. So first they tell us number of records, number of hospitals and countries, right? And then they go on to tell us the different percentages, descriptive characteristics. They also tell us, they give us the median age, also descriptive characteristics. They go on to tell us some of their bivariate analysis. And lastly, they tell us their multivariate analysis, right? in the findings section. And yeah, so the last aspect of the first part is the references used, are they relevant, and then recent and referenced correctly. So basically, for you to actually be, for you to be able to answer that critically, you must, one, kind of like have like a fair idea of the field. So meaning, as in kind of like you should have had some exposure to the field so that you would know which articles or which papers are relevant to the field, right? But when I did look, all the papers were relevant. Most of their studies were recent. So recent is usually probably the last 10 years, thereabouts. So you're looking at papers from 2012 or 2011 or 2010. And although there are few old papers like this, but they're just few. So majority of the papers were recent papers and referenced correctly, and then they were also relevant. Okay, so any questions, any contributions so far? Hello?
No question. Yeah, well, it is. It's clear. No
Okay.
question from my end. Yeah.
So next thing is to look at the introduction. So basically, the first thing to tell us in the introduction, as they should, is first of all, you would try to look at, okay, what the burden of disease is. The disease we're talking about in this case is TBI, right? And that's how they do start. They tell us that, okay, the burden is great. There's a large burden of, there's a large global burden of TBI worldwide. That's very important, right? Next, they tell us that a large amount of such substantial number of patients with TBI would require emergency neurosurgery, right? Next important point is they go and tell us that this is going to be particularly important in LMICs where the burden is greatest, okay? And like I said earlier, they mentioned the fact that data is kind of like missing on the epidemiology of these patients. So patients who have TBI that need to be treated surgically, we don't know what the epidemiology is on this patient, right? And so they designed this study. Now, yeah, so the method, so for the methods, right, the very first thing, like I mentioned earlier, is to look at how the study was designed. So they used the prospective observational cohort study. So what that simply means is, so an observational study is one that's you're kind of like looking at a snapshot, right? You're not doing any intervention. You're just sitting down, literally, on a chair and just looking at what's happening, okay? You're not adding any intervention. You're not doing anything new. You're just observing. And so perspective is they collected data from starting point and then went forward in time. So that's basically what it is, right? And now they didn't define a particular region. So they wanted to describe the epidemiology globally, okay? So they reached out to any hospital worldwide that was performing emergency neurosurgery. And this is very important to note. So they use something we call convenience sampling. So convenience sampling, reach out to a number of people and probably send out surveys, whoever fills the surveys, and then that's what you would use to analyze as your data, right? While convenience sampling is sometimes good for some study designs, it's prone to a number of biases, as I would show you as we go on. But when I was thinking about it, I think that was probably the best thing they could do for this particular study. for them to be able to answer this question, right? Okay, so basically what they did is they reached out to various neurosurgical societies, right? And then sent invitations to hospitals, to doctors who are working in centers that performed emergency neurosurgery, because that's the patient group, right, they were looking at. And then they had them collect data on patients who were eligible. Now, it's very important, very, very important when you're describing your methods to state clearly what your inclusion and exclusion criteria are. Because if you don't do that, then you wouldn't be able to adequately collect the information you need, one, and then get to the right conclusion, okay? And definition of inclusion and exclusion criteria is mostly dependent on your aim, right? The aim of the study. And so, although not written here, they have this large appendix, it's almost 60-something pages. So there it's the clearly words what their inclusion and exclusion criteria were. So the primary thing they're looking at is patients who were treated, who had emergency surgery for TBI, okay? So what they did was, so the inclusion criteria was one, any patient, no age restriction, right? So any patient, anywhere in the world, because they're trying to describe the global epidemiology, right? So anywhere in the world, any patient who had TBI, okay? So also they did not specify the severity of TBI because again, their aim was so TBI in general, okay? So any patient with TBI who had emergency surgery. Now the surgeries were, now this they defined, okay? Surgeries for acute epidural, acute subdural, okay? Extradural, acute extradural hematoma, patients who had decompressive craniectomy, okay? Because these are surgeries we do for patients who have TBI, depending on what their CT scan shows and things like that, right? So they defined it clearly, what their inclusion criteria were, right? Now, this was very interesting because they went in depth on how data was collected, right? So first, you had multiple teams from, you can have a team from a participating hospital. So they sent invitations, hospitals will reply, say, okay, yes, I'm interested in participating in this study. Then the hospitals would come up with teams who were students, who were researchers, who were doctors, neurosurgeons, right? Come up with teams to collect data. And data was collected for 30 days. So for a 30-day period, right? Now, it was possible to have multiple teams collect data, but the multiple teams would collect data at separate 30-day periods, right? And then they had like a start time in 2018 and then ended in 2020. So during this period, any 30-day interval, like continuous 30 days, then they collected data during that time, right? So that's what this was trying to say, right? So any questions? Any questions so far? Any comments, any contributions? Okay, so no comments, no contributions, okay? All right, so the next step was, so that's the first part of the methods section, right? Picking centers, eligibility criteria, and things like that. Now, very important, one advantage of a prospective study over a retrospective study is the fact that you would not have high level of missing data, because you're collecting data so strictly to avoid that. So that's like one very important difference between a prospective and retrospective study, right? Or one, not difference, advantage, okay? So, so they ensured that first, they used an electronic web base, and the next thing they did was that they ensured the questionnaire was such that if you had missing data, you could not complete that questionnaire. So you had to ensure that everything was filled in the questionnaire. That's one. Secondly, from each participating hospital, they had an individual who, would I say, who was, so they had like checks and balances. So the individual would ensure validity of the data collected. So this was, so after you're done collecting your data, okay, for the patient, next thing, weeks later, would I say validity, the second individual, okay, would go look at the data, compare it to what they actually had at the hospital and see, okay, this was filled correctly. And so that's another very good point I took from this, okay. Now, in your methods, it's very important to always define what your outcomes are. More often than not, you would probably have primary outcome and the secondary outcome. Now, the primary outcome in this study was the mortality at 14 days post-op, okay? So the patient died, yes or no, at 14 days post-op. Or, so it was either mortality at 14 days post-op. If anything happened to the patient before 14 days, that was also taken. The patient was discharged at 14 days, also taken. So, but that was the primary outcome of the study. Then you had various other things that were secondary outcomes, length of stay, length of hospital stay, ICU, surgical site infection, and all those things. Now, before you start carrying out your research project, it's always good to have a protocol written for various reasons. One, so that you would have something to always look back on when you start the project. Two, yeah, so that's the major reason, to have something to always look back on when you start the project. And they had a protocol which was published. I think I have it open here. They had a protocol, published it, and the plan they set out to do similar to what they eventually did in the end. So that's also something very, very good. So prior to starting the study, they took the questionnaire and looked at what we call the internal validity of the questionnaire. So basically, you want to say that, okay, the various questions in the questionnaire, are they misleading? Are they questions that are not so clear and things like that? And so they did a pilot study in Zambia, I think. So I'm not particularly sure right now. And then when they did that, so it usually helps, one, you look at the consistency of the questions amongst the respondents, people responding. And then you also, when you're done with that, next thing is so any questions that were not clear or things that you think should be changed, then you do that as well. So that's usually very good to do. And then that was done as well. Okay, any questions? Okay, so back to this. So far, they clearly stated what was already known about the topic. They told us the burden of disease. They also clearly outlined their research question, and their research question was justified because, one, they did, like I showed earlier, they did a systematic review to see, okay, has the question been answered in some way before, which it hadn't, and they just kind of like gave, yeah, so it was clear, was already known. The research question was clearly outlined in the introduction and it was justified, all right? So for the methods sections, yes, so these are very important things to look at when you're critically appraising a paper. What the study design was, they told us prospective observational cohort study. They also told us the scene, where the study will be carried out, and also gave timelines, which are usually very important because you want to be as specific as possible, okay? And they also mentioned variables. For those of us who read the paper, I'm sure as you started at the very beginning, they mentioned the title of the paper, they kind of like, yeah, so for the aims, they tell us that, oh, okay, looking at across different levels of human development. I'm sure it probably came to your mind that, okay, what do they mean by human levels of development? Because what you normally see or what you know is WHO classification of different regions like low and middle income countries, high income countries, and things like that, right? So that was the very first thing they did in the statistics to tell us, okay, this is what we mean by human development index, okay? And that's also something very important to do when you're designing your own study, is to ensure that you try to give definitions of things that probably would not appear so clear to everyone. I mean, what we know is the World Bank classification, low income countries, middle income countries, and high income countries, right? So that was the first thing they did. They told us this is the definition, measure of socioeconomic development, right? Very important. Now for analysis, analysis usually occurs in stages, okay? So general picture is you have univariate analysis, bivariate, and then multivariate analysis. So basically your first step is you're looking at, okay, so the first thing is to describe, all right, your data, okay? So give descriptive characteristics to your data. And so that's usually done with either mean, median, or frequencies, percentages, and things like that, okay? So that was the first thing they mentioned, okay? So we summarized data with medians and interquartile range, as well as numbers and percentages. Now, medians and interquartile range are usually used for quantitative variables. So variables that are just numbers, okay? For qualitative variables, things like yes or no, male, female, that's when you use percentages, all right? Or categorical variables, you use percentages. So that's usually the first step, okay? The next step is to talk about bivariate analysis. So bivariate, so univariate, one variable. So usually this, okay? The next step, so before I go on, median and interquartile was used because their data was non-normally distributed. So it's very important. So first thing to always do when you want to start analyzing your data is to look at the distribution. Normal distribution has the very nice Gaussian curve. Okay, non-normally distributed, most of the data is probably skewed to one side. Any question? Okay, so so I was saying, right, the next thing is bivariate analysis, okay? So in bivariate analysis, you want to compare two groups, okay? And so they looked at the difference in the various human development index, okay? And this is usually done with a number of tests. The selection of the test would depend on your the two data you're looking at. Are they both quantitative? Is one quantitative or qualitative? And then things like that. And these are the tests they use based on data they had, all right? Then they tell us that, okay, they stratified the results. So divided them into groups by using age, okay, by severity of the traumatic brain injury, and then by surgical procedure done. The last step is usually multivariate analysis. And then this is when they talk about, so this is when you have multiple variables, not just one or two, multiple variables. And more often than not, or sometimes, it's usually used to look at things like maybe predictors, which is what they use it to do in this case. So they kind of like looked at what variables predicted the outcome, basically. So that's what they did in this case, okay? And then they go on to tell us how they went. So to do the multivariate analysis, you need to kind of like build models, okay, from the various variables you have. So it's usually like a step-by-step thing. Then they went in detail to talk about that. Okay, all right. So any questions so far before I move on, before we talk about the results? Okay, so Elvis Lando, I think, has a question. Could I comment on arriving at sample size limitation and confounding factors in research methodology and how you can reduce or limit them? Okay, so I'm going to talk in context to this question. So yes, very important. In your methods, okay, it's always good to define a sample size. And there are various formulas to use. There's a Cochrane formula, various formulas to use. The formula to use would depend on a number of things. One, has a study been done before? What's the proportion or the percentage of a particular outcome they found in a previous study showed, and then things like that. For this study, because one, there's not much data available elsewhere, but literally nothing has been done like this before. So there is no formula you can use to kind of like calculate sample size for this study. But that doesn't mean that, oh, okay, you would get to it, you just use any random size. So you use a size that you think that, okay, this should be probably appropriate. So one thing they did is, we're looking at globally, right? And then we'll get to that when we look at the results section. Let me just quickly mention that, okay? So when looking at it globally, so what number of hospitals do I think would represent a good global picture? Yeah, so I mean, somewhere between 100 to 200 hospitals. Okay. And so they had about 159 hospitals in 57 countries. And for each of these hospitals, I would expect, so probably maybe 5 patients, as looking at previous data that's talked about number of patients with TBI or TBI burden, maybe 5 patients a day or something of that, or something like that. And then that would kind of like give you an idea, okay, I think this number is good. But more often than not, for most studies, when you're giving your sample size, a lot of formulas exist. So you have to, first of all, know what is out there, and then knowing the various formulas, which would be most suitable for your study. The next question was confounding factors. So, so confounding factors,
yeah,
basically, yeah. So confounding factors are things that would that usually have an effect on both your outcome, okay, and so both your independent and dependent variables, so to speak. And so there are things you have to limit or restrict when you're doing your analysis so that it don't affect your results, all right? And it's usually dependent on your research question. There are usually some general confounding factors you look at, probably age, sex, and things like that. But it is mostly study specific, depending on what your question is, okay? And once again, another way to figure out what the confounding factors are is to see this study that has been done before, what has been reported as some confounding factors, okay? Yeah, basically. All right. Okay, so next thing is our results. So questions to ask yourself when you're looking at the results is, one, the data presented, was it presented in an appropriate way? Okay. Tables and figures, are they relevant and clearly presented? Appropriate units, rounding, number and decimals, title and columns, and rows labeled correctly. Did they group categories appropriately? Does the text in the results add to the data, or is it repetitive? Are you clear about what the statistical significant results are? Are you clear about what is practically meaningful result? So these are questions you should be asking yourself anytime you're looking at results, okay, for any research. Now, tables and figures. Once you're done with your analysis, one of the very first things you should do is, before you start writing, is to draw up tables and have figures out, okay? Very, very, very important. And as you can see, that was literally the very first question that you want to probably ask yourself, okay? And that they did. Yeah, so for most of these questions, it was properly answered, all right? So now the first figure we look at is this. So they tell us how this figure, it tells us how patients were selected, okay? First, patients, the study was carried out between November 2018 and January 2020. So they reached out to all the hospitals. Hospitals gave individual records for indoor patients during a 30-day period, one or multiple 30-day period per hospital, whichever the case, all right? And in total, in those 2 years or so, or less, I think, they had about 1,867 patients, okay? The next thing they did were records that were incomplete, they excluded them. And remember what I said, so a prospective study, you shouldn't be having incomplete records. That's the whole point of a prospective study. I think that's like one really good advantage is you want to ensure you have little missing data as much as possible. Sometimes it's not really possible, as we can see here, but yeah, so that's what you want to do. And so they excluded records that had incomplete data, okay? Next, they included 1,783 records, all right? And they excluded 148 records. This was for different things, okay? Quite a number for duplicate records, because, so remember I said, one, it might have either been one team that collected a record more than once, or two teams in the hospital that collected records more than once, right? Now, this 59 was most likely from the person validating each center. So they had like a second person, not part of the team collecting data, but a second person who was validating the data that was collected. So basically ensuring that, okay, this data that was collected is correct, as in the data that we filled into the form, spreadsheet, or whatever it was, their web-based system, is actually correct to what we have hard copy. Okay, so and then these were not within 30-day study periods, excluded as well. So finally they had 1,635 records. Okay, so that's what the first figure is. And so I like that this was the first figure one, because it quickly gives us an overview. I mean, they collected data from a large, like from a lot of people. So it gives us an overview of, okay, this is exactly what we did. This is how we got to the data we used, all right? And then, yeah, so they tell us majority, 328 records were from high HDI, 539, and like that, and like that. So that's the first thing. So, yeah, it's just to point out to you guys that looking at tables and figures, even without reading text, you almost always have an idea of, probably even more than idea, have like close to 90-something% of what the result is, because tables and figures are the result section, right? The next thing they go is this map, all right? So this is like a heat map, so to speak, where you have various places lighting up, world map, various places lighting up, and you have keys, and then they tell you what the map is for, right? Now, for this map, they tell us it points to various characteristics. So, I say socio-demographic characteristics. The first map points to which countries or which cases were from various human development index group, right? The second map tells us the overall age. The last map, the next map tells us mechanism of injury, surgical procedures, and all of those things. I think I've opened the maps up, so we could, okay, great. So the first map told us what's the human development index were. So the various, so from the 1,600 records or so, which parts of the world, which development index were there, right? So as we can see, and then there are keys to kind of like really interpret the map and all those things. So here we have the really dark green ones were the very high index group, and that forms quite a good number. The high human development index group, also a large number. Very important to see is that low human development index group, just a few. I mean, I would expect all these other places to be low, but I mean, but they were not, they didn't get records from these other places. So they just had a few, okay? Yeah, and a few from the medium group as well, okay? The next thing, they show us the age from like everyone. So not separating it based on index, human development index group, but all the records that was collected. Next, they look at GCS as well, okay? Right. So the fourth heat map looked at what the most common mechanism of injury was. And you can see from most of the very high index group, right? You have falls. That's very important. And then as we're talking more about the result, I'll explain why. And then from low, you have mostly road traffic accidents, right? That's also important as well. The most common surgical procedure done in very high and in some high index group was evacuation of a supratentorial subdural hematoma, right? For low human development index group was more an elevation of depressed skull fracture. And this also I'll explain as we go further. All right. So the first table, so usually the first table is usually a description of your social demographic characteristics, okay? So in this case, It was characteristics of the hospitals that participated. And then they divided the hospitals based on their human development index, okay? So first thing, right? First thing to see, or one of the first things to note is that they had significant difference. There was significant difference in the proportion of healthcare costs that the patients paid for, okay? There was a significant difference. And if you look at it closely, you can see that as we went from very high human development index to low human development index groups, you can see that the amounts that the patient paid for health care for low development, patients paid for almost all, some or all. For high, the patients, so out-of-pocket spending was almost zero for high, okay? So that was one significant thing that was found in characteristics of the hospitals, okay? Another thing to note is the availability of resources. So very high index group, this was a significant finding as well. Very high index group always had CT scan available in their base hospitals, okay? Completely different story in the low human development index group. Same with ICP monitoring, 0%, okay? So significant differences, all right? High-speed drill, okay, so sometimes what you need to do is probably want to do a borehole or something, so you need, you always need a high-speed drill, okay? Not always, but I mean, you kind of like need it. It improves mortality, reduces time for surgery, and all those things. Now, for high index group, almost all their cases, they use this. Low index, completely different story. Okay, so those were findings that were significant in the characteristics of participating hospitals. Some of the characteristics, significant findings. The next characteristics again, but now of the patients. So the first one was characteristics of the hospitals. Next table they had the characteristics of the patients. And this table is a really abridged version of the actual table in the study because they looked at quite a number of things, but they only included findings that were statistically significant. The others, probably later on you can, it's in the appendix, the very large appendix I mentioned again of the study. So now, very first thing to note is that the median age, okay, was statistically significant, all right? And they stratified the age less than 18, greater than 65, all right? Patients who were greater than 65 were more seen in the very high index group. Okay, so what was confidence interval for the p-value? Yes, so confidence interval was set at 0.05 and not my confidence interval. I didn't write this paper, so, but the confidence interval the author set was at 0.05, okay? All right. So now, median age, so they found that the very high index group had most of their patients were older patients, while for the low and then the medium, you had more of younger patients, okay? And this can be correlated, just like looking at it as face value, to the mechanism of injury. So for falls were seen more in very high Human Development Index group. Road traffic accidents, assaults were seen more in low Human Development Index group. And this also, this is kind of like something we already know, that patients, when you have like an elderly patient with TBI, mechanism of injury is more likely to be from a fall rather than road traffic collisions, right? Or from an assault. Younger patients, road traffic collisions or assaults. And also we know that this is patients who are having road traffic collisions, assaults, are more seen in low Human Development Index group. This is probably as a result of one, bad roads, younger patients being more, taking more risk and things like that. But this agrees or ties in nicely with what we already know on this, all right? The last table was the outcome. So remember, primary outcome was mortality, 14-day mortality. Patient died, yes or no, or patient was discharged, yes or no. So that was what it was at 14 days, okay? And there was, so yeah, the medium tier group had the highest number of mortality, okay? So this was across varying things, across patients' age, across TBI severity. They had the highest number of mortality. Right. Now, so the last step of the analysis was the result was to describe the predictors of outcomes, okay? And so does anybody have an idea of how to interpret this? Anybody, does anybody know? I mean, just looking at it, can you, so first thing, okay, is to, so you have the odds ratio, you have the confidence interval, and your p-value. So your p-value tells you, one, if the findings are significant. That's one. So for the odds ratio, you're more or less comparing the odds of either you're comparing the odds of your control to your intervention. And so, but in this case, they compared groups and then they held to the fixed variable, so to speak, was very high development index group, okay? And these were the things that they saw that, okay, these things were predictors of outcomes, okay? First, younger age. Next thing they looked at was severity of, what's it called? Severity of TBI. Then they looked at the ASA. The ASA is the Anesthesiology Society, American Societies of Anesthesiology. So it's just a score that they used to say, okay, is this patient fit for surgery and things like that. And grade 3 was, a score of 3 was statistically significant. It was like a predictor of good outcome or poor outcome. Yeah. So this was the last stage of the analysis, looking at the predictors of outcomes, okay? So, but all in all, generally, the results were good. They had, they described their results, tables and figures were relevant and clearly presented. The text did not contain repetitive information, more contained additional information, and then it was, the results were practical and then meaningful as well. So the last aspect is the discussion. So important things they pointed out was, one, there was quite a number of differences among various human development indexes, okay? Mechanism of injuries, you had more of assaults, road traffic collisions in low development index than you had in the high development index, where it was more falls. And this also pointed to the age of the patients as well. Then you also had, right, for neurosurgical procedures for low development, low human development index, they had more of depressed skull fracture elevation. And this ties in nicely with the fact that there were more assaults in the low human development index, okay? So that also explains that analysis. Right. So one very important thing they found when they did their logistic regression was the fact that there was variation between hospitals. So you have hospitals in the country. The mortality varied between those hospitals. Okay, that was one very important thing they found. There was not so much variation. So what that meant was that, so you had hospital A, so you have, say, a place like Rwanda, for example, you have like a small city, and then probably had 3 hospitals that participated in the study. The mortality varied between the hospitals, so hospital A, B, and C, but there was no variation between countries in a human development index. So a place like Rwanda and Nigeria, the mortality didn't vary, but within each country, the mortality varied within the hospitals. I hope that's clear. So, so that kind of like points to, okay, we should probably start thinking about, instead of having a more global, say, protocol or guideline, a more country by country guideline, then we should start thinking about, okay, guidelines to guide each hospital, like each hospital in treating patients with TBI, because that's something very important, and that's something they found. Yeah, so to the last aspect, I think the study design was appropriate to answer the aim which they set out to do. They already told us what was known about the topic. They told us the gaps that were missing. I don't think there were any major flaws. One thing I would say is that, I mean, and they also stated it as a limitation to their study, was they had not such a large amount of patients were from low human development index, okay? And I mean, we know that there is a high burden in that group, right? So how much or how well can the results be generalizable? I'm not sure, but that's one thing to take home or one thing to think about. But I mean, there was no other. I also tried to think about, okay, how else would they have probably done this? How else would they have, yeah, like what other means would they have tried to gather the data? Convenience sampling is practically a good first step to use, sorry, which they did. Yeah, and the article was consistent within itself. Yeah, so that's it. Thank you. So any questions? Any questions?
No question from my end.
Okay. So no questions. So it's probably we all understood, or we didn't understand at all, but okay, that's fine.
I enjoyed the presentation. I was able to follow through.
Okay, all right. So, so for journal clubs, it's always good to, for journal club, it's always good to read the articles before coming for journal meetings, so that you would be able to follow. So, I mean, a lot of you are saying you enjoyed the presentation, but it's supposed to be more of a discussion, right? So you're supposed to look through. Also, you're supposed to use the problems review guide, so that you have an idea of what questions to be asking yourself as you're reading each section. So it's very important. So you wouldn't gain much from a journal club if you don't read the articles before coming. It's kind of like pretty important, so that there's back and forth. Okay. All right. Thank you very much. I'll be handing over to Neon. So I hope I got that pronunciation right.
Hello. Thank you, Dr. Anthony. It's Nawantla here. So Darwin had to leave the meeting, so I was left as the host. And I would basically say thank you for that wonderful presentation. I guess the problem we had was that like a lot of people hadn't read the article. So yes, we got the message at the end. For the next journal club, I guess everyone is advised to read the article beforehand. Please do that. Do we still have no questions or comments for Dr. Anthony? Okay, I'll take the silence as no questions or comments. So I'd like to thank everyone who attended. Thank you so much for your presence. Have yourselves a good night. And until we meet again, it's a goodbye for now.